All right, everybody, so we're going to be doing a video regarding 4 different topics. So in this video, we're going to be talking about greeting the patient, patient identifiers, patient orientation, and then general survey. So each thing I will announce to you guys what I'm doing so you guys understand which one is which. So let's start off with greeting. This one's easy. The first thing we're going to do when we come into a patient's room is we're going to greet the patient and just build a connection with them, right? So the first thing I'm gonna do is I'm gonna knock on the door, and then I'm going to enter the room and I'm gonna say, "Good morning, Mr. Johnson, how are you today?" And then this way we let the patient know that we're here to see them and that we are going to start our procedure, right? So once we have greeted the patient, the next thing we need to do is introduce ourselves. This way the patient knows who we are, what we do here, and what we're planning on doing with him, right? So I'm gonna talk to Mr. Johnson and say, "Well, Mr. Johnson, my name is Mr. Khan, or Nurse Khan. I'm going to be your nurse for the day, and I'm here to perform a procedure for you, okay?" That was me letting him know that who I am, my title, and that I'm here to take care of him for the day. All right, so now that we've introduced ourselves, we're going to move on to the next step, which is assessing the patient's orientation. We're going to use the 4 questions, which is time, place, person, and situation, just to make sure that the patient is fully cognitively there, right? So we're going to ask the patient, "Okay, Mr. Johnson, can you tell me your name?" And he's going to tell me his name. Next, I'm going to ask him his date of birth, and then I'm going to ask him where he is and what he is doing here. These 4 questions, as long as he answers them correctly, will let me know that he is oriented to all 4 of those categories. Next, while we're on the topic, he's given me his name and he's given me his date of birth. I'm going to assess his wristband. So I'm going to say, "Mr. Johnson, can I take a look at your wristband, please?" And I'm going to make sure that the information that was given by the patient matches what is on his wristband. This is how we use our 2-person identifiers. We ask the patient and we use the wristband as a second identifier. Nextly, we're going to do a general survey. Now, normally there's not really questions that we ask for this. We're just going to be assessing the patient while we're in the room, right? So while I was doing my greeting, my introduction, and my orientation assessment, I'm just going to be assessing the patient. I'm going to look at his age, his skin tone, his body posture, his hygiene, and clothing. So now, for his age, I'm just going to look at what I've seen on the chart, whatever his age was. I'm going to look if the body matches. I'm going to look at his skin tone. So whatever skin tone that was on his chart, I'm going to make sure that there is no discrepancies to that. Then I'm going to look at his body posture, making sure that there is no hunching over or any discrepancies on that. I'm going to look at his hygiene and his clothing, making sure that his nails, his hair, everything is looking clean. And then for the clothing, I'm going to make sure that he is dressed appropriately for the weather. This is how we can tell if somebody is in maybe some financial situations or maybe some cognitively situations that they're not taking care of themselves. So while I'm doing my assessment, I'll be looking for all of those things. So that I think covers the 4 topics. We'll look forward to the next video. See you guys in the next one.